I'm Dr. Belim Wasim, Siraj from Department of Periodontology, Yenepoya Dental College, and today we'll be discussing on clinical features of gingivitis. So here, as we can see, the clinical image of healthy gingiva. As you can see, there is absolutely no inflammation. The gingiva that appears to be pink with some melanin pigmentation. Coming back to the very basic part of gingiva, that is a part of the gingiva. So we have a free gingiva or gingival margin, we have interdental gingiva, we have mucogingival junction, we have attached gingiva, and we have alveolar mucosa. Here we have your free gingival margin that is covering the collar of the tooth, as we can see here. Then we have attached gingiva here. So we have an interdental gingiva, as you can see, between two teeth. And then you have a mucogingival junction, the line that is differentiating between the attached gingiva and the alveolar mucosa. And then you have your alveolar mucosa here. Okay. So coming back to clinical features of some of the clinical features that you may see in gingivitis that is altered from the normal gingiva. So first and foremost, we have a color. So as we already saw, the color of the normal gingiva is pink or coral pink with some pigmentation that could be a melanin pigmentation, which is altered during gingivitis. The color changes to red or bluish red. Okay. Then we have a contour of gingiva which is scalloped with knife edges that may also get altered during gingivitis and becomes edematous with blunt margin and rounded edges. Then we have a consistency of gingiva which is firm and resilient in normal healthy gingiva, which may get altered during gingivitis or during inflammation, which becomes soft and edematous. Okay. Then we have a bleeding on probing or bleeding on provocation, which is normally absent or very minimal in normal healthy gingiva, which may be altered or which may be present during gingivitis. Then we have a gingival exudate that is minimal or absent in your normal gingiva, which may be present or significantly increased during gingivitis, and a circular temperature which is roughly around 34 degrees centigrade that may also be altered or increased during your gingivitis. Coming back to the color of healthy gingiva, so as we can see, we have a very healthy pink gingiva which is coral pink in color, or in some cases, as in Indian population, we have a slightly more different hue of a gingiva which can be seen in these clinical images. Also we can see some amount of melanin pigmentation that is present in the gingiva. So coming to the changes that we may see during the gingivitis, as we can see here, the color of the gingiva has changed from pink, it has become erythematous or red. Same way here we can see in this image, as we can see, the color has become reddish pink in color. Here as well, the gingival color has changed to erythematous. So these are some of the clinical images that gives us the idea of the color changes that may be visible during gingivitis. These are the diagrammatic representation of erythematous gingiva. As we can see here, the most common local factor that is responsible for gingivitis is your plaque and dental calculus. So that we can see, because of the presence of these local factors, the color of gingiva has become reddish or erythematous from your normal pink gingiva. So the normal color of gingiva is coral pink, as we discussed. It is determined by the vascular supply of the gingiva, the degree of keratinization of the overlaying epithelium, and the presence or absence of melanin pigmentation. During the inflammation, the color of gingiva may changes and becomes reddish pink to bluish pink, as we have seen in the clinical images, depending on the degree of vasodilation and engorgement of the blood capillaries. So these are the reasons why the color changes from pink to reddish or reddish blue in color. Coming back to the contour of the healthy gingiva, which is another parameter that we observe during the diagnosis of gingivitis. So here we can see the contour of the gingiva is scalloped with knife edges, as we can see in these images. It is scalloped with knife edges or sharp edges without any rolled out or blunt margins. So this is a sign of a normal healthy gingiva. Then we have a gingival contour that may get altered during the inflammation of gingiva. So these are some of the clinical images where we can see the scalloped margin has become rounded and the blunt edge, the sharp edges or the knife edges have become blunt or bulbous. So these are some of the clinical variation that may be seen during the gingivitis. It can be a blunted papilla, it can be a bulbous papilla, it can also be cratered or rolled out margin, as we can see in these images. This is the diagrammatic representation of rounded contour with blunt edges. As we can see very clearly, the knife edges of the healthy gingiva has disappeared where it has been inflamed. So the healthy gingiva has a scalloped and knife-edged contour. The contour of the gingiva changes in various clinical conditions, as we saw. In an acute or chronic inflammation, the margins may be rolled or rounded. In the gingival enlargement, the interdental papilla may also become bulbous, as we saw in the images. Coming to one of the other parameters that is important, that is consistency of healthy gingiva. So as we already discussed, the consistency of healthy gingiva is firm and resilient. So how do we determine the consistency of this gingiva? So to determine the consistency of gingiva, a lateral pressure is applied to the attached gingiva and presence of indentation is observed. So if there is an indentation in the attached gingiva, that means the gingiva is healthy, firm and resilient. If the absence of indentation is there, that would indicate that there is an presence of inflammation in the gingiva. Coming to soft and edematous gingiva, as it is altered during gingivitis. So if the gingiva has inflammation, the gingiva would become soft and edematous, as we can see clinically in these images. So the consistency of healthy gingiva is firm and resilient. It depends on the underlying connective tissue. In gingivitis, the gingiva becomes edematous, demonstrating a soft consistency. Another parameter that is important to observe is surface texture. So the surface texture of normal healthy gingiva is orange peel appearance. So what do we mean when we say orange peel appearance? It means the healthy gingiva has a stippling that is present on the attached gingiva as well as the interdental gingiva. So there will be elevation and depression that is present in the healthy gingiva, which is a sign of a healthy, clinically healthy gingiva. That may get altered during gingivitis or the inflammation of gingiva. The stippling may be absent. So as we can see, the gingiva appears glossy when there is an inflammation present. That is due to the lack of stippling. So the normal surface texture of the gingiva is stippled with an orange peel appearance. It is best viewed clinically by drying the gingiva, which is commonly observed on the attached gingiva and central portion of the interdental papilla. During the inflammation, stippling is lost and the gingiva appears smooth and shiny. Coming to the size of the healthy gingiva, usually the size of healthy gingiva is not enlarged. As we can see, there is adequate balance between the pink portion of the gingiva and the white that is stored. So it is not enlarged during a healthy gingiva. Whenever there is an inflammation, it can be enlarged, known as an inflammatory gingival enlargement. So here are some of the clinical photos or clinical pictures of inflamed gingiva, which is clinically enlarged, as we can see in these images. So gingival enlargement is an increase in the size of gingiva. It is common clinical condition usually seen in acute and chronic gingival inflammation. It may also occur due to other reasons such as drug-induced gingival enlargement, neoplastic gingival enlargement or false gingival enlargement. Okay, then we have a position of the gingiva. So normally the healthy gingiva is slightly placed coronally to the cemento-enamel junction. So as we can see, the gingival margin, the free gingival margin is coronal, slightly coronal to the cemento-enamel junction. So during the gingival inflammation, this position may get altered. That is, it may move apical or it may move coronal, as we can see in these images. Here the gingival margin has moved apically, whereas here the gingival margin has moved coronal to its original position. So this is the altered position of gingiva which we can see during the gingival inflammation. So here we have a diagrammatic representation where the gingiva may move coronal to CJ, or it may move apical to the CJ. So the normal position of the marginal gingiva is 1 to 2 mm above the cemento-enamel junction, as we already discussed. The position of the gingival margin may move in the coronal or the apical direction in various inflammatory conditions. Coming to the bleeding on probing, that is the most important parameters to diagnose a case of gingivitis. So bleeding on probing is normally absent in healthy gingiva. As we can see here, the bleeding on probing may present or may be increased during gingival inflammation or in gingivitis, as it is visible in these clinical images. So gingival bleeding is one of the earliest symptoms of gingival inflammation. Bleeding during probing is a very important finding during routine examination. It results due to dilatation and engorgement of the blood capillaries. So coming to the conclusion, gingivitis is one of the most common lesions encountered in the clinical setting and may be the first sign in many types of periodontal diseases. That is why it is important to know the clinical alteration that may be visible or that may be present during gingivitis, so that we can prevent it from becoming a periodontal disease. Thank you.